Senior Wellness Hub brings important updates on health matters that affect millions of older adults. And in recent years, blood pressure targets have quietly shifted, creating new considerations for people over 60, where depending on exact age within that group, the number physicians pursue could potentially work against patient well being. As too high blood pressure remains widely recognized as dangerous, yet too low levels carry their own serious risks for older adults that rarely receive adequate attention, according to a landmark study published in the New England Journal of Medicine. Aggressive blood pressure lowering in seniors over 75 significantly increased rates of kidney injury. Dangerous pressure drops upon standing and falls, the kind of falls that lead to hospitalization and permanently alter daily lives. So, determining the right number for someone in this age category becomes essential. And this discussion provides clear, specific answers tied directly to age and health situations for adults between 60 and 79 years old who maintain reasonably good health. Current evidence supports a blood pressure target below 130. Over 80, meaning the systolic number should stay under 130 and the diastolic number under 80. While for adults over 80, that target shifts meaningfully with research supporting a slightly higher acceptable range where systolic pressure between 130 and 150 is considered appropriate, especially for those who are frail, have a history of falls, or manage several medications simultaneously, and this difference exists because blood vessels become progressively stiffer with age, representing a physiological fact that alters cardiovascular system behavior. When individuals were younger, vessels possessed elasticity, allowing them to absorb the force of each heartbeat and maintain steady, consistent pressure throughout the day. But as elasticity decreases, pressure grows more volatile, swinging dramatically, often elevated in the morning, then dropping suddenly when standing up quickly or walking across a room. And that sudden drop from a seated or lying position, known as orthostatic hypotension, serves as one of the primary causes of dizziness, fainting, and falls in seniors, which matters greatly if a physician targets systolic pressure below 120 based on older guidelines. While the body already experiences these pressure drops, then real risks arise every time rising from a chair or moving to the bathroom at night. And this observation stems directly from clinical data in multiple large-scale trials. The SPRINT trial, published in the New England Journal of Medicine in 2015, followed more than 9,000 adults with elevated cardiovascular risk and determined that patients with systolic pressure reduced below 120 experienced a 25% lower rate of heart attacks and cardiovascular events compared to those kept below 140. Yet many cardiologists noted concerns upon closer examination because the trial excluded people with diabetes, those with previous stroke, and anyone with significant kidney disease at baseline. And when subsequent researchers applied aggressive targets to more realistic groups of older adults, including frailer patients and those managing multiple conditions, the risks of falls, declining kidney function, and fainting episodes became clearly visible, representing documented outcomes linked to pushing blood pressure too low. Unlike the original trial participants, while a separate major investigation, the STEP trial, published in the New England Journal of Medicine in 2021, followed more than 8,500 adults aged 60 to 80 and showed that maintaining systolic pressure between 110 and 130 reduced major cardiovascular events by 26% compared to a group kept between 130 and 150, thereby supporting tighter control. But again, these involved relatively healthy adults in the 60 to 80 range rather than seniors managing multiple medication or exhibiting frailty, and the medical community has addressed this tension through guidelines updated in 2021 and beyond, which offer nuanced yet clear recommendations if an individual falls between 60 and 79 years old without dialysis, advanced kidney disease, or frailty assessed by a physician. Then the current target remains below 130 over 80. And for those 80 or older, guidance from the European Society of Cardiology, supported by data from the HIVET trial, which studied patients over 80, recommends a systolic target between 130 and 150, as the HIVET trial demonstrated treating elevated blood pressure in people over 80 reduced stroke risk by 30% and overall mortality by 21%. Though the target stayed below 150 systolic, not below 120, and that distinction proves critical. Consider the situation of Harold, who, at 76 years old, had his medications adjusted by a doctor citing sprint trial findings to push systolic pressure below 120, resulting in readings of 117 over 71 that appeared excellent on paper. Yet Harold experienced afternoon fogginess and two near falls within a month, while rising from his recliner, prompting his daughter to request a standing blood pressure test, which revealed sitting pressure at 119 over 70, dropping to 94 over 58, after 2 minutes of standing, indicating his body could not compensate adequately, after which the physician reduced medication, slightly targeting a sitting systolic of 128 to 135, resolving the dizziness within 3 weeks, showing that while numbers appeared less perfect, Harold gained steadiness, alertness, and reduced fall risk. And this highlights how blood pressure measurement methods influence medical decisions. Since office readings taken after walking through a busy area and sitting in an exam chair can run 10 to 20 points higher than actual resting pressure due to white coat hypertension, affecting up to 30% of patients, potentially leading to overly aggressive treatment from a single stressful reading, while masked hypertension, where office readings seem normal but home or activity levels show elevation, affects another substantial portion of older adults. And a 2022 review in the Journal of the American Medical Association indicated home monitoring identifies clinically significant differences in roughly 1 out of every 5 patients, representing a meaningful percentage whose treatment plans could mismatch their actual blood pressure reality. The diastolic number deserves greater attention than usually given, as research from Johns Hopkins published in 2021 raised concerns that in adults over 65 consistently falling below 70 links to higher risk of heart attack, heart failure, and cognitive decline, because the heart muscle receives its blood supply during the relaxation phase, and if diastolic pressure drops too low, coronary arteries may not receive adequate flow during that phase, potentially starving the heart, despite successful systolic control. And this relates to the J-curve phenomenon, where both excessively high and low pressures increase risks, with the safest range in the middle for diastolic pressure. In older adults, physicians often consider targets between 70 and 80 millimeters of mercury appropriate, while readings consistently below 65 warrant careful review of the medication regimen, and everyone should take specific actions based on this information, beginning with monitoring blood pressure at home twice daily, once in the morning, before medications or breakfast, and once in the evening before dinner, using a validated upper arm cuff monitor rather than wrist cuff, which proves less accurate in older adults with circulatory stiffness. And before each reading, sit quietly for 5 full minutes without talking. Then take 2 readings, 2 minutes apart, recording the average, doing this daily for 2 weeks before bringing the complete log to the next appointment. As 2 weeks of accurate home data holds greater clinical value than 3 rushed office readings. Individuals should know their personal target according to age group, with those 60 to 79 who are not frail or managing advanced kidney disease aiming for systolic below 130 and diastolic between 70 and 80, while those 80 or older should discuss with their physician whether systolic 130 to 150 fits their health status and medication load, and requesting a standing blood pressure test. At the next visit proves essential by sitting for 5 minutes for baseline, then standing for readings at 1 minute and 3 minute marks, where a systolic drop over 20 points or diastolic over 10 points indicates orthostatic hypotension, possibly needing medication adjustment to prevent falls, and paying close attention to diastolic readings remains vital if falling below 65 regularly, especially with 2 or more blood pressure medications, as changes must occur only under physician supervision to avoid dangerous rebound effects, yet armed with home logs. Standing test requests and knowledge of age-appropriate targets. Patients can engage in productive conversations with doctors about whether current plans suit their actual circumstances. And in cases of severe sudden headache, vision changes, chest pain, or readings above 180 over 120, immediate care should be sought as a hypertensive emergency, while the core truth remains that no single blood pressure number suits every person over 60. Instead, the right target depends on specific age within the range frailty status, other health conditions, and how blood pressure behaves when upright and moving, rather than just sitting in an exam room, with evidence providing clarity for informed health management. And Senior Wellness Hub continues delivering such research-based insights to support better understanding and decision-making for older adults navigating these important matters.